Well, a very warm welcome back for our final debate of the day, recruitment. Along with efforts to retain current NHS workforce, which remains a priority, of course, across the NHS, leaders must look at ways to rapidly recruit across the board. So, how are healthcare organisations filling critical positions? From employee benefit programs to nurse career paths that exceed the public sector apprenticeship target and generate local employment. In this discussion, we'll explore various recruitment techniques to enhance our workforce, whilst our panellists share best practices, future innovations, and challenges facing healthcare. So, to help us navigate NHS recruitment, I'm delighted to say that I'm joined by Melissa Glynn, PreEmployment Project Co-ordinator at Black Country and West, and Mandy Buckley, Prince's Trust Recruitment Project Manager at Mid-Cheshire Hospitals. Don't forget, you've got the live Q&A function that you'll find at the bottom of your screen. And you're very welcome to submit a question to Melissa or Mandy as we go along. Final push, so don't forget to get involved in our conversation. Ladies, it's fantastic to see both of you this afternoon for our final debate. We have got the luxury, because there's only two of you as opposed to the planned three guests, we have the luxury of a little bit more time. So I thought it'd be really nice to start off with you, Melissa, if I may, telling us a bit about your role and what you do.
Thank you very much, Helen. So, hi all, my name's Melissa Glynn. I'm currently on currently on secondment to the ICS from the Prince's Trust, the Birmingham kind of centre. So the aim of my role is to support young adults into the ICS, whether that's through apprenticeships, employment or volunteering, and really help them get into health and care and understand what it is and really give back to that workforce. I can do this by many different ways, but the main way is helping with pre-employment programs and really giving advice and guidance on the different opportunities that are available to them.
It sounds like it's a really satisfying role, Melissa, is it? What do you enjoy about it most?
Yes, it's extremely satisfying. The best thing about the role is when you've worked with a young adult for a very long time and they get that offer of employment at the end. The happiness on their face is really, really rewarding.
I'm sure Mandy's nodding away there. I mean, you're Mandy, you are Prince's Trust Recruitment Project Manager, so you've got that common connection there with Melissa. Tell us a bit about what you do and how that differs to Melissa's role.
So hi, I'm Mandy. As you said, I'm the Prince's Trust Project Manager at Mid-Cheshire Hospitals. We're based at Leighton, just outside Crewe in Cheshire. And I sit a little bit differently to Melissa. So my post's really new. It's only been up and running since November last year. Prior to that, I sat directly in the recruitment team at Mid-Cheshire Hospitals. So I've kind of got first-hand experience of the kind of challenges that are facing recruitment in the NHS in general, but obviously specifically to our hospital trust. So I can kind of have a good understanding of where our managers are coming from with a vacancy and some of the struggles that they're facing in terms of getting the right person into that post. But now in my new post, I also sit with a foot in the Prince's Trust camp. So similar to Melissa, working with young people to encourage them into career pathways in the NHS. And obviously that's kind of mutually beneficial for the young person who gets an amazing career, or an amazing start to their career. But it's also hugely beneficial to the trust to have those new pathways and a new kind of flood of amazing kind of young talent that's available to kind of come along and join us. So I get to see the benefits from both sides, which is doubly rewarding.
Oh, it sounds doubly rewarding too. I mean, Melissa, even before the pandemic hit, the health sector was struggling with underfunding and added pressures from increasing demands of an aging population. How deep a crisis, Melissa, do you think we're in at the minute in terms of recruitment?
I think it's very difficult to say, really, but with all the right pipelines that's been discussed at the moment and lots of secondments like I am and the work Amanda's doing, I think helping the new younger workforce come in will definitely help, and also taking new ways of recruitment on board. So not just taking the normal approach of NHS jobs, CVs, application forms, but holding open days pre-employment programs and really speaking to the younger community. So going into schools, colleges, and really showing that health and care is a career and that it's not just a job will really help.
And do you find, Melissa, that the reaction from young people is receptive? Are they keen to hear about these new opportunities and keen to get involved?
Yes, definitely really receptive. When we start at the Prince's Trust, when we started our health and care kind of contract, it was just when COVID hit, and the influx of young adults we had coming through really wanting to give back, even though we was in the middle of this pandemic that we'd never been in before, was absolutely astonishing. And now that is still there. Lots of young people really desire to be in health and care and want that career.
But of course, with everything, there's always barriers. What barriers do you think young people are currently facing in recruitment?
I think some of the barriers from my perspective can be kind of functional skills and maths and English qualifications for some of the entry level roles within health and care. Sadly, some of our young adults don't have them just due to multiple different reasons. So school might have not been the best experience for them. They may be a young carer, so they might have had to have cared for a family member. So sometimes that can be quite off-putting when they see that on a job description and person spec. And just because they don't have a formal qualification, that doesn't stop them being able to be very competent in that role. They have all the skills needed, such as empathy, care, and the kindness. It's just supporting them getting that kind of formal qualification. Another thing also that can be quite a barrier to young people is previous experience, because some of the higher level roles, so the band 3 roles, so the experienced, they want that experience, and they do have that experience from caring for loved ones or maybe even their own children, but sadly that's not the formal experience that sometimes is required.
Oh, you're so right when you talk about, the skills of empathy and care, and sometimes that's lacking, and that's so important, within the NHS, that those skills, if you like, are present. Mandy, the Prince's Trust project is a partnership between 3 NHS trusts and the Prince's Trust, and it's one that I wasn't aware of actually, so I'm really interested to hear more. But what recruitment challenges were and are Mid-Cheshire hospitals facing?
So I guess the same sort of challenges that are present across the wider NHS at the moment. Melissa's touched on some of this already. We've got an ageing workforce. We're not always seen as being the most attractive employer. There's some barriers in place there with people's perception that working for the NHS isn't well paid, perhaps, or that maybe the long-term career pathways are not there, and it's seen, I think, by some, Melissa, still as a job rather than a career. So there's a little bit of challenging some of those perceptions that sits with me, in conversations that I have with young people, to say, you might start off as a porter or a domestic or a healthcare assistant, but actually there's a career pathway available to you if you wanted to become a qualified nurse, if you wanted to become the head of estates. You can go kind of anywhere. So that perception exists still, that the NHS is just doctors and nurses. So certainly the challenge of attracting talent that sits outside of those professions is a barrier for the NHS, or a challenge for the NHS. So, for example, we've got our own in-house estates team, and for a qualified electrician or plumber, we're not seen as being an employer of choice. They wouldn't think to come to the NHS with that skill set. So again, sort of breaking some of those myths, I think, and trying to get the message out there that we employ wider than just doctors and nurses. Oh, there's all sorts of challenges, and I'm not even going to go anywhere near the mandatory vaccination conversation, the headache that posed us for months. But obviously that's not in place now, so that's one that's gone.
Yeah, but how do you dispel those myths? And, you are right about people thinking that the NHS is full of doctors and nurses. You mentioned they're an electrician, but yeah, I don't even think, and I host lots of these conferences within this sector, and it doesn't occur to me that there's way more opportunities beyond the obvious medical roles. So how do you get that message across?
Do you know, it didn't occur to me either. So I've worked in the NHS for the last sort of 5 years, and prior to that I worked for Virgin. I worked in an entirely different industry.
Wow.
Similar role, so still involved in sort of recruitment and L&D, HRE type stuff, but never thought for a second that I'd be working for the NHS, because again, I just didn't see it as somewhere for that kind of career. So, you know, if I had that preconception, it's not surprising that other people do too. So largely we've been doing lots of work on social media to try to highlight the other roles that we have available for our, you know, for our local community, to try to get them to think a little bit wider than just the clinical roles, and reaching out to other agencies. So, you know, some of our local government employment agencies, to say, hello, we're here, we've got these career pathways that are open to people. So yeah, just trying to do as much as we can to widen people's perceptions.
Do you find the same thing, Melissa, when you talk to young people, that they see roles within the NHS as jobs rather than a career path?
Yeah, definitely at certain points. It's really explaining to them about the different progression routes. There's some great tools out there as well to go through all the different careers within the NHS and explain how they're able to get into them. So I always find when I'm working with young adults or anyone that's come and said they're interested in getting into health and care, is really signposting them to where all the information is, really having a breakdown with them of the different kind of career options, whether they want to be a domestic staff as soon as they come in, or a clinical support worker, and where those roles can take you, because there's so many different opportunities now to come in as a healthcare assistant, then go up to a nursing associate, and the progression is absolutely amazing to really support these young adults and the older workforce as well, to help them within their career paths. Because the great thing about the Prince's Trust and being able to do the roles what myself and Amanda do is really explaining that it's not just a job. It's not like just going and working in Tesco's. There's lots of career options, there's lots of progression, and there's lots of benefits to working in health and care. I know it's sometimes not sold that way, because it's a very demanding job. It's very hard to work in health and care, and it is kind of a vocation. You've got to want to do it, but really explaining that to people as soon as they said, oh, I'm interested in that way, really gets them involved and really helps them to be able to plan their journey and be able to kind of then visualise where they want to be in the next 5 years.
And Melissa, can you give us any examples of innovative ways that you're currently using to recruit young adults?
So there's lots of different ways that we're trying to recruit, young adults at the moment, and we're looking into lots of different possibilities. One way that we find always works quite well is open days, where a young adult can come and speak to us, and lots of people from lots of different areas, to find out first-hand experience what that kind of role will be, what a day-to-day case will be for them, kind of what the salary is, and really speak to them firsthand to go, actually, I can see myself in that role. One way that at the Prince's Trust and kind of within my role that we're doing it at the moment is as well is really pushing it on social media, as we find we get a lot of outcomes through social media because it's just a click away. It's nice and simple. You don't always need to speak to someone over the phone. Straight away, you can get to know someone first. And Eventbrite as well, that's a really good tool for us. So what we're doing at the moment is setting up Eventbrite taster days where they can come and speak to myself or different colleagues about kind of where they would like to go. And then we're offering them mentoring, one-to-one or pre-employment programs so they can find out a lot more information. And also they don't have to say, oh, I've got to apply for that job right now. There's a bit of a time in being able to think about it, make sure it's the right role for you, and make sure it's actually a career path you want to go down, because applying for jobs in health and care isn't always straightforward. It's an application form, it's an interview, it's quite daunting. But when you've got someone next to you every step of the way saying you can do it, you find that, again, that person gets more invested.
Oh, that sounds fantastic. We've got a few questions in. Perhaps one for you, Mandy. Pam asks, how does the Prince's Trust decide who they'd work with to help in their recruitment?
So we only have 2 criteria for the Prince's Trust. So the person has to be aged under 30 and they need to be sort of resident in the UK. So that's the only 2 criteria. So I've supported within that a huge range of people, and it's so exciting, it's so rewarding. It's helping to open the doors up to the NHS as an employer to people that just wouldn't have thought to apply to us previously. So I'm working with some young adults with learning difficulties, for example. I'm working with lots of young single parents who just need a little bit of support with things like the shifts that they're available to work. So that's the main one, I think.
Fantastic. And Melissa, Matthew says, is it important that we also try to recruit employees who have experience from other sectors and who can bring and apply that learning to health?
Yes, definitely, because within health and care, even though you need certain qualifications at certain points, every sector has transferable skills. For example, if you've worked in customer service before, that customer service skill will be really great to transfer into front of house, maybe a ward clerk, or actually looking into the clinical routes. So everyone has those kind of built-in skills and built-in talents that will be transferable across, especially if you've worked in different sectors. Like Amanda said, she's previously worked at Virgin, so those amazing recruitment skills she's learnt there has transferred over so well into her new role. It's just learning kind of the vision and value of what that organisation or NHS trust you're going into is about.
Mandy, how did the Prince's Trust co-location partnership come about? And are you unique in the country, or are there other partnerships like yours?
We're not unique, but I like to think that we're amongst the first. So, and certainly in the area. So the Prince's Trust saw the value in supporting kind of young people into this sort of health and social care, and approached the three local NHS trusts. So I work primarily with Mid Cheshire hospitals, but we're working in partnership with East Cheshire and Countess of Chester. So the Prince's Trust approached the three trusts and said, "Hey, have you thought about hosting a co-location partnership?" I'm lucky that the three trusts that I work with are really forward-thinking and progressive, and said, "That sounds like a brilliant idea. Let's do it." So that was how my post came about, really.
And is it your 30th birthday? Because there's something
No,
moving.
I know. I'm really flattered that you think that I'm 30.
It's
Thank
quite
you.
funny. There's a lady in the background just moving the balloons into shot. So she's just moved them. We can see them now. So it's not your birthday.
It's not my birthday. I wish
No,
I was 30.
Me too. I can't even remember my 30. That's such a long time ago. Melissa, what pathways are you able to put into place to support new employees? So it's one thing getting people involved, but once they accept their role and they get into position, how can you help them ease the way and retain those roles?
So how we do it is when we've helped a young adult through their different journey of coming into their new organisation or their new role, we still offer them support after that. So we can offer up to 6 months support through the Prince's Trust to make sure they settle into that role. They've got someone to come and speak to if they're a bit worried to speak to their manager, because that can be quite daunting, and that they've got someone explaining kind of every step of the way. And what we're also trying to implement more is more buddy systems. So where they've got someone on the ward or the department they're working in to be a buddy for a longer period of time, because we've started to do some work and found out that if someone retains their role for over 3 months, they will stay much, much longer. So up to kind of 4 or 5 year mark. What we really want to do, because we're putting all these new skills into this young adult and this new employee, so we want to retain them for as long as possible within their role, because we can then develop them and make them the best person possible for the new organisation they've joined.
Mandy, that support is critical, really, isn't it? And I could imagine being a young person going into the NHS world, which is, it's big, 1.3 million people working in the NHS. I would imagine that support's equally as important as getting the right people in the first place.
Yeah, definitely. And just to echo what Melissa said, really, we're doing very similar things. So I'm here, so beyond their start date, and you know, I've had some of my candidates kind of ring me up and just the silly questions that, like you said, Melissa, they don't want to ask their manager. So things like, you know, where do I go for my lunch? I don't want to ask my manager because I don't want to sound like an idiot. So they can kind of just come and ask me even the simple questions like that. But we also have a formal kind of buddy scheme in place. So we'll pair them up with someone that will kind of take care of them and look after them in a more informal way than their manager would. And then we have pastoral staff. So we've got pastoral health cares. So there's lots and lots of routes. And you'd like to hope that ultimately also they'd have a good relationship with their manager. So they'd see that as a pathway for some support too.
Do you get into schools as well, Mandy? I mean, do you go and talk to, you know, GCSE students or A-level students?
Yeah, so only last week, we were at one of our local high schools doing a careers event there. So talking to young people from year 9 through to sort of sixth form A-level students, and doing the same thing. So raising some awareness of the NHS as a potential future employer for them and making them aware. We did a really good game with them of, you know, is this an NHS career or not? So having them kind of go through things like electrician and doctor and put it in a yes no pile, and, you know, helping just for them to see that there's bigger opportunities in the NHS than their initial perception. So yeah, that's great fun. I love doing things like that.
Oh, it sounds good fun and really inspiring, actually. Melissa, question from Matt. For trusts which are in busy urban areas or overlap with other trusts, how do we deal with the competition for talent? Do we need to work collaboratively? I can't even say that at this time of day. Collaboratively between trusts, seeing it as benefiting the wider health service.
So that's how at the moment, because we've got a lot of people in my area that want to work at lots of different trusts. So we're trying to get everyone to come together collaboratively within the ICS and do recruitment in a unique way, in a different way to normally. So we want to do kind of a pot of recruitment and then ask the people that have come through and accepted the job offers where they would like to go and give us their top 3. So it's kind of universal recruitment in a way to really be able to support each other, because we don't want to be I'm trying to think of the right words to say now, stealing the great candidates from other places. We want to work together because we all want the same outcomes. So it's looking at collaborative working at the moment, really seeing if we can do kind of a one-based recruitment. And also something that we're speaking about within my trust where we're working is rotational placements. So they're rotational contracts where the young candidate or the successful candidate will go and work somewhere for 6 months, then move over to the next trust for 6 months, and then really be able to make and decide where their best choice is. Because sometimes you think you just want to work within your local area, but if you're offered to go and experience kind of one just a little bit further, you never know, that might be the best fit for you in kind of a department that you would never have thought of.
Yeah, collaboration is key, really, isn't it, Mandy?
I was just going to say, even for me in a rural trust, so I work in a really rural setting. You know, our next nearest hospital is over at Macclesfield. It's kind of 20 miles away. But even with us, and certainly through the Prince's Trust, we're finding that collaborative working is much more successful because we can offer, you know, the candidate a better choice, a better fit. You know, instead of that somebody thinking, well, I've got to commute to Crewe for the role, and if we can place them in a job that's kind of closer to where they live with a smaller commute, they're more likely to be retained, they're more likely to stay. So even in a rural trust, I think that collaborative working's got a real part to play.
And Mandy, is the co-location partnership, in your opinion, worth it working and a really positive thing?
Well, it's like I said, it's early days for us. So I've only been in post since November. But already I would say to any NHS trusts that we're kind of listening to this and thinking, well, this might be something that we could explore, or something that we could approach the Prince's Trust to and see if you can kind of work together in a similar way. I would say do it, go for it. Because if I can share a story, and I'm sure I've shared Catherine's story before with other people, so if you can make a difference to just one person. So Catherine was a young lady who was suffering from some anxiety, and we've placed her into an apprenticeship role working in the library with our librarian, and she's just blossomed. So making a difference to one young person, if that's all it does, it's worth it for that.
Oh, I'm sure it is. Alice has got a question, Melissa. She says, Melissa mentioned accessing tools and information on different recruitment and career pathways. Where can we go to look for this information?
So the NHS website is absolutely filled with lots of information where you can look at that. Another great tool for anyone, even younger ages, so in school, is the Health Careers website for the NHS, because that will show every different pathway and every different career to go within the NHS. If they're kind of the younger, so the school level, there's a really interactive quiz what you can do where it gives you your top 5 careers based on your answers. If you're at a uni kind of stage, it tells you what you need to do at uni to become kind of what you want to. And if you're looking at kind of a new career aspect, there's lots on that as well. So I really say, if you've got some time, go and have a little explore on that website, because it's an amazing piece of tool.
Mandy left us there with a very personal story of somebody that really stuck out in her mind, who's blossomed, and this program has made a real difference to. Melissa, do you have anybody whose first name you can share with us? Any story of somebody that you think that's a perfect example of how all of this works and makes a difference for young people's lives?
Yeah, so I had this lovely lady called Taz when I first started my role back 4 years ago. So when I was just before my co-location partnership that I've kept in contact with since. She started really wanting to get into health and social care. She did one of our pre-employment programs, and she's recently got back in touch with me because she dropped off a bit because she had personal issues, to say that she's now applied to uni to become a paramedic, and she's been accepted onto that apprenticeship. So even though it was 4 years ago, so it was quite a while, she's always kept in contact, because that's the great thing about our roles. If we are still there, we are still here to help you, and we will never turn away a young person from the Prince's Trust. We will support them as much as possible, whether it's at the start, the middle, or their end of journey. We're still here to help. So it's absolutely amazing that she started really unsure, and now she's off to uni in September.
Oh, what a lovely way to end not only our day, but also our whole day. So thank you, Melissa, and thank you, Mandy. You're both doing a sterling job, and you can see in your eyes just how much satisfaction you get from helping young people. So on those positive words from Mandy and Melissa, we draw to a close. My thanks to Melissa and Mandy, and a very big thank you to everyone who's taken the time out to join us today. We've covered a breadth of challenges, opportunities, and solutions as we've engaged with the topic of workforce in the NHS. Whether you're one of our excellent panellists or part of our audience who've been sending in questions, listening, or sparking conversations with other delegates, thank you from the team here at NHE 365. And thank you to our fantastic event partner, without whom events like this simply wouldn't be able to take place. I look forward to seeing many of you at our next event on Net Zero NHS, which takes place actually on my son's 13th. On May the 26th. Please share the word with your colleagues. This is certainly a topic that affects everyone. If you're a winner in our gamification challenge, the NHE team will be in touch to discuss your prize options. And separate to gamification, today's event was CPD certified, with 1 CPD point earned for every hour watched. If you'd like your CPD certificate, then please email marketing@cognitivepublishing.com. From me and everyone at NHE 365, thank you for attending. Have a great rest of the day, and hopefully I'll see you soon. Bye for now.